These are the test implants or sizers. I'm gonna see if I can do it with my left hand so that you guys can see. And so I'm gonna go ahead and remove the sizer. Usually I have my assistant in the back here. But notice how there is absolutely no bleeding when we do these at the Cosmetic Surgical Center of Cerrito. And now we're gonna go ahead and put our silicone implant, right? So I'm gonna set the implant for, I'm gonna set the, I mean, Avis, you can come in, you know, up to the ceiling like that, very good. And we're gonna go ahead and put our implants, right? And this implant, the valve is down. So you do what you do with the killer funnel. You can come out with this and give them space so that they can see how we advance this silicone implant. How easy can this be, you guys? It's incredible. Yeah, a few seconds. And silicone breast implants here at the Cosmetic Surgical Center of Cerrito. We'd love to teach you this, give it to the world. It only takes a few seconds. Surgeons, this is not that hard. You can do it. Come and train with us. We'd love to see you. Women, if you want, this procedure is the new thing. It's incredible. Silicone implants is a world discovery. And we can put these implants through the belly button with a tiny, tiny incision. You know, this incision is actually bigger because we're gonna do a tummy tuck, but normally we can do it like about this big. Zero risk of bleeding, zero risk of infection, zero risk of capsular contracture so far since I invented this procedure. So I'm gonna go ahead and use my left hand, non-dominant hand. I'm not pulling on these really, I'm just holding it, right? And now we're gonna go ahead and, if you pull on these, then the implant will ricochet. I usually have my assistant, you know, put her hand in here so that if the implant were going to ricochet back into the chest, but notice the complete absence of bleeding when we do this. This is incredible here at the Cosmetic Surgical Center of Cerrito. We'll now go ahead and put the silicone implant, right? So you can come in and I'm gonna set these retractors up for you, right? And she's gonna pull up to the seating at the 3 and 9 o'clock positions. And you do what you do with the Keller funnel. The valve is down. Make sure that this implant doesn't go into the wrong funnel, right? So I'm gonna go ahead and advance it. And that's all there is. It's just a few seconds, you guys. She looks incredible, beautiful. No scars on her breast, no scars on her nipples, no scars on the inframammary fold. The incision is usually just about short of 2 centimeters. She looks absolutely beautiful. The risk of capsular contracture with this approach is 0 so far. Since I invented this procedure on July 20th, 2020, and now is now is September 30, 2025, 0 capsular contracture, 0 bleeding, 0 infection. This is just an incredible procedure. This, by the way, has been already published in the Annals of Plastic Surgery. I did my first presentation for the American Academy of Cosmetic Surgery on this discovery on February of 2021. And I have, along with Dr. Jacob Hayabi. Dr. Jacob Hayabi saw my presentation at the American Academy of Cosmetic Surgery. He gave me a call, and Dr. Hayabi is a friend of mine. He's a professor. He's a great doctor. He's done plenty of this, and he has a teaching program. He has done a lot of saline implants, but when he saw my silicone breast augmentation, he called me up, and I basically, gave him my technique, and this is incredible. Dr. Wang from China was the very first one who did this procedure, and she came to see me when I was doing a presentation at the American Society of Cosmetic Breast Surgery in Newport Beach in 2019, and I was then teaching the transabdominal, in other words, through an abdominal incision, which is what we're going to do a tummy tuck on her, and then put her under the coastal margin, right? But she told me she can do it through the belly button. Now it's marvel. I cut the presentation short and put her to present at the meeting, and she said that she had 3 problems. 1, the surgery will take her over 3.5 hours. 2, the implants will break during insertion. 3, there was significant bleeding. And to my surprise and with the help of God, I was able to correct all those 3 problems. So my first breast augmentation on July 20, 2020 with silicone implants through the belly button. The time was 55 minutes instead of 3.5 hours. The bleeding was, like you can see here, about 5 ml instead of significant bleeding, and no implant rupture. How did I do this? Instead of doing one central tube where one central tunnel where all the arteries are, I avoided the arteries by going laterally with the traditional transumbilical saline breast augmentation. Is basically the same technique that was developed by Dr. Hydrodissection with tumescent anesthesia. I modified the technique so that I put 2 milligrams of epinephrine and I wait. That's probably the most important thing to avoid bleeding, is to wait at least a half an hour before you start. So the epinephrine clamps down. I know epinephrine works within 15 minutes theoretically. Trust me, if you wait at least a half an hour, it'll be bloodless like this. You're gonna love it. In addition to that, no implant rupture because I advanced the implants manually, as you could see. The tunnel is done with hydrodissection. The pockets are done with hydrodissection. There is no sharp instruments. The risk of pneumothorax is 0 basically in my hands, and it's because we don't use electrocautery at all, as you can see. This is electrocautery free surgery. You're gonna love it, and there's no reason why. Why would you have scars on your breast, armpits, or nipples? Why should the scars be 12 centimeters instead of 1.5 or 2 centimeters, which is the usual what we do here? In this case, we made it bigger because we're gonna do a tummy tuck, so we wanna make our life easier. But this is the way we do it. And why would you have a risk of bleeding, risk of infection? This risk are near 0 with this approach. Is incredible. So I encourage you all to do it. Again, the technique described by Dr. Jacob Hayabi, his fellow Dr. Emma Ryan, and myself, Dr. Hayabi and myself as the senior authors in the Annals of Plastic Surgery, January of 2022, I think, or yeah, thereabouts. Thank you. Alright, so notice the complete absence of bleeding here at the Cosmetic Surgical Center for Cerrito. So what we're doing is an extended abdominoplasty, and as usual, there is absolutely no bleeding. Thank you. Alrighty, so what we see here is a completely bloodless surgery. You can see the right here, the abdominal wall fascia, this strong white membrane you see there, right?
Yes.
But what you don't see is any bleeding, right?
Right.
This is deep subcutaneous tissue here, and then this white membrane right there is scarpless fascia. Can you see okay?
Yes.
And you see this blood vessel right here?
Yes.
Okay, I'm gonna go ahead and get us a clamp to throw to that blood vessel, and I'm gonna show you. But right now, look at this. This is incredible. The blood vessel is already almost tearing. So I'm gonna go ahead and clamp it right there, so that you can see it here. Hold on. You see it right there or no?
Yeah.
So it looks purple. The reason why you can see it is because everything around it is beautiful anatomy, like God made it, right? So there's absolutely no bleeding. So look at this. See, we go through that blood vessel with 0 bleeding, right? We identified it. Why? Because of the contrast. If normally all these would be completely red. And you're gonna pick up opposite to me right there. There we go. And so what we're gonna do is, this is the pubic, you see that hair? There's the pubic hair, the vagina is right there. And I'm gonna show you how we do this in a completely bloodless manner, okay? This is another thing that's pretty incredible here at the Cosmetic Surgical Center for Cerrito, that there is absolutely no bleeding. When you basically have this procedure with the traditional technique, you're expected to bleed. And look how bloodless and immaculate this is. I say this is definitely a special technique. I've never seen any other surgeon do this. I don't want to say this because I'm a humble person and everything, but this is just incredible, beautiful, bloodless technique. meaning that the risk of anemia, the risk of blood transfusion, even the risk of infection is much less. Why? Because there is no bleeding, right? And so much less risk in complications with this procedure. I compare this to driving during the day, where you can see the clear sky, you can see the road, you can see everything. Instead of driving at night in the dark, you cannot see the sky, everything is dark. And that's when there is the bleeding. The bleeding basically, instead of this being yellow, it'll be all red. Instead of this being white, it'll be all red. You would not, and the blood vessels are also red, so everything is red, so you're gonna run into the blood vessels. So here, this technique, I can see the blood vessels and I can burn them before they bleed, right? That's the technique. And so it's a lot better for you guys, and much faster recovery also, because the blood, when it's outside the blood vessels, is irritating to the tissues and it can give you pain, painful nodules, etc. So this is just incredible. Much less risk and complications, many advantages, much less risk of seromas also, which is a collection of fluid. Everything is better. Thank you. Alrighty, so what we're doing now is we're doing the tummy tuck. This is an extended abdominoplasty, so we decided to go a little higher because when we did the specimen, we realized that we marked twice, right? We marked twice and cut once, right? So look at this. See, this is incredible surgery here at the Cosmetic Surgical Center of Cerrito. But I have a different special technique. See, I look for the blood vessel. There's a blood vessel right here. So instead of cutting with scissors and there's going to be a lot of bleeding, see, I look at the blood vessels first and then I go. See, so if you would like to have a procedure like this, please give us a call, 510-525-7999. Operators are standing by. The number again, 510-525-7999. Please call us if you would like to have a tummy tuck in this fashion. Please call us if you would like to have a breast augmentation with either saline or silicone implant through the belly button like you just saw it here. No scars on your breast, armpits, or nipples. Much less risk of bleeding, as you can see. The risk of bleeding is near zero. The risk of capsular contracture, which is the most common complication, meaning that the implant can become very hard and eventually break the implants, right? The implants are being squeezed, if you would, by a very tough scar, almost like an internal keloid, an abnormal scar. It's like a capsule that starts compressing on the breast and eventually breaks them, and then there is like 4 degrees of capsular contracture. A thin capsule is normal. That's a grade 1. A grade 2 is when the breast feels firm. A grade 3 capsular contracture is when there is deformity. In other words, the breasts are squeezed to the point that they're deformed, and you can visibly see them deform with your naked eye, right? And a capsular contraction number 4 is where there is calcium, like a wall, basically. You can touch the breast and it's like you're touching a wall, you know, like a rock, extremely hard. And so what I'm saying is that with these techniques, the risk of capsular contracture is basically zero. We haven't had a single case since I started doing this procedure here at the Cosmetic Surgical Center of Cerrito. This procedure with silicone implants, right? In July 20, 2020. No capsular contracture yet, thanks to God. We want to keep it this way. So why would you want to have a risk? With saline implants, the risk of capsular contracture in studies have been reported to be 0.2%. That's almost nothing, right? But with silicone implants in my hands, zero. That's incredible. And basically, you know, the risk of capsular contracture when you go through the armpit, for example, is 23 times more. Why? Why would you want to have, you know, scars on your armpits with a higher risk of of a capsular contracture, bleeding and infection. It doesn't make any sense. Thank you.
Hi, this is the specimen on the left side of the patient, and as you can see, no stretch marks, all the stretch marks, and no bleeding. Turn it. Thank you. This is the specimen on the right side. As you can see, all the stretch marks are here, and there's no bleeding. Thank you.
So what are we doing now?
We are epithelializing the belly button.
Yeah, I'm gonna go ahead and do that in a second. So basically, this is the new home for the belly button. The belly button is inside, and this is where we're gonna bring the belly button out. You can remove your hand from there. Okay, very good. So, but notice that, I do this so that there is absolutely no bleeding, right? This is incredible. You see any bleeding there? No. So we go down to this layer of the skin and a little bit fat there, but what you don't see is any bleeding. So we're gonna go ahead, and after I do this, then Shania is gonna spray so that there is no, there we go, so there is no bleeding, right?
Right.
There we go. Thank you. Alright, so we're doing triple antibiotic solution here. Just one more measure to keep everything, less risk of infection, something that we do routinely. You can see I reshape the belly button nicely to the similar shape to what's outside. Look how nice, flat, and tight she is. We did a rectus plication, meaning that we put the rectus abdominal wall muscles together in the midline where they belong. We restore hair anatomy to pre-pregnancy state, because these twin muscles that are joined in the middle, the rectus abdominal muscles or the six-pack, usually separate during pregnancy. So she's not going to have any more babies, so we put them together in the midline. And now we're going to parachute the umbilicus or the belly button through new skin. But look how nice, beautiful she looks, flat, tight. And this is a double rectus plication for those doctors watching out there. The underlying deep suture is a figure 8, and the superficial suture is a running or proline. Thank you. Wow, look at this patient. She looks absolutely stunning. This is a transumbilical silicone breast augmentation with subpectoral silicone implants. In other words, we put the implants under the muscle through a tiny incision in the belly button. You saw it. And this is an extended abdominoplasty. She just looks incredible. Not a single bruise, no bleeding. She just looks very, very beautiful. No scars on her breast, no scars on her nipples, no scars on the inframammary fold, no scars on her armpits. Basically a scar-less breast augmentation. The only scar is the natural scar in the belly button, which, she was gonna have anyway from the tummy tuck. This is a tummy tuck with zero liposuction, yet you can see the athletic lines. Part of it is the tunnels that we made to put the implants, give it that extra edge here. So it looks very athletic with the transumbilical silicone breast augmentation and extended tummy tuck in a bloodless fashion. Here at the Cosmetic Surgical Center of Cerrito. If you would like to have a procedure like this, please give us a call. There is no reason, zero, why would you have scars on your breast. Come here and we'll love you to do it. That's for you women, spread the word. No more scars on my breast, okay? That should be a slogan. Come to Dr. Patino. And for you surgeons, learn this procedure, because this is the way of the future. What you're doing is in the past. All these scars, that's in the past. The higher risk of bleeding, higher risk of infection, higher risk of capsular contracture with the traditional approach. This approach is incredible. The risk of bleeding is near zero with this technique, especially with the tumescent anesthesia. The risk of infection is near zero with this approach. And also the risk of capsular contracture is near zero. And we would love to teach surgeons here. We do workshops. We had a workshop last week and on the 16th, right? 9/16, 2025, we had a workshop. I invented this procedure on July 20, 2020. It's been over 5 years, zero capsular contracture, zero infection, zero implant breakage during insertion, zero complications as far as all of them have been actually submuscular under the muscle implants, no lateralization of the implants, nothing like that. It's incredible. So they look incredible, and we published this with Dr. Jacob Hayabi and Dr. Emma Ryan. The only complication I had was we had one tunnel seroma and one umbilical unsatisfactory scar, but that's about it. Thank you.